The point is by treatment, suppression by treatment, either homeopathy or allopathy, by giving medication, you are not suppressing. These are internal. These are internal. What you are saying, that constant grief, constant unhappy occurrence, constant unhappy marriage. Next, the vexation, stress, that is all internal, constant happening into the mind of the person. And they are divided two, psychical and physical. Physical, what happens in physical diseases whenever there is a blow or an injury? Next one. What happens in this kind of cases? Now, what is the explanation of this? Hahnemann has said this and I understand and I take it as a science. This is also given in Robbins. What happens when the cell injury happens at a mass level, like burn, or the soldiers when they march for 20-30 kilometers a day in a very fast pace? What happens? In wound, it is burn, hard labor. What happens in the body? I understand this, what he has written. Whatever he has experienced, his insight, he has written, but what happens in this? Why the person goes sick? If you see, surgery के बाद भी fever आता है, long surgery के बाद. Is it one of the cause for fever is the long surgery? What happens in that? He was talking about it, that is what I am speaking about. There is a lot of protein breakdown, and that breakdown causes the fever and the further damage to the body. Constant diarrhea, lot of breakdown, and that breakdown causes the diseases, because already the immune system goes down again, or the miasm again in a dominant role, and that brings out the diseases. Yes.
A patient has come to you for asthma, and if you give a medicine and asthma gets better and better, and if he develops eczema, then what we should interpret, what we should understand?
Asthma was not better. It was quiet for some time. That's all. The asthma may be one of the. That's what I'm saying. That is what. Go to the level first. That's what the whole thing is. It doesn't happen. What happens in that first one, second slide. The incubation ke time. The whole of the organism is incubated by the primary disease. When the primary disease is there, whether you treat it or not, if you leave it there, it may remain quiet for a long number of years. Now, already the body inside is covered with the miasmatic, the incubation time, that is all throughout the body it is spreaded. Now, we have removed one disease, that is a tendency to develop other diseases are also there. It may come at that time, or maybe 5 years and 6 years later, the same patient may come with the asthma again. We have the patients, they come up with the same complaint. It may be quiet for some time, it may come up with a second disease. Second disease doesn't mean that you suppress the asthma and the eczema has come up. It is not. That is what he is saying. It is incorrect to say. It is what he is saying. It is incorrect to say that one disease has been driven inside to the body, and that is really how the disease develops. Again, I will come back to you. Nerves wala nikalo. Nerves. The moment of contagion, that is the first time. How the disease goes into the body? First time. Even for example, coronavirus has come into the body. What they say? Not that everybody got the corona symptom. Why if you got it? Because that has penetrated beyond the epithelium or endothelium. Body responds only when the corona goes beyond the endothelium or epithelium. It may remain into the air. You have got it, contained it, but my body is so strong that it has not been allowed to get inside. Once that is inside, it gets spreaded, according to Hahnemann, by the nerves. And it spreads to the whole body in just a single moment. Now, whatever is site of entry of the contagion, whatever you try to manipulate or clear it off, it doesn't go off. Like he has given example of gonorrhea and syphilis. Once the contact has happened, even if you chop off the organ, it is not going to go off. That is what he has given the example in chronic disease. For thousands years and years, the disease is going on, and still they are cleaning the local parts. In syphilis and gonorrhea, that was the treatment that time. And patient used to get the bubo, secondary syphilis, tertiary syphilis. That used to happen. Once the disease is inside, it doesn't remain there. It gets carried into the body by the nerve. It is communicated all through the body. First time itself. Once it is communicated, it is penetrated and it gets penetrated to the whole of the body. Unless it is covered and penetrated all over body, it doesn't get expressed outside. Once it is outside, that means the internal completion is done. only then expression is outside. So internal completion, once it is done, first expression was asthma. You have treated that. We feel that we have treated, but it is not. It is the eczema which comes up is because of the primary में जो गया था उसी से वापस second भी आया, third भी आया. And for that, aphorism 200 I would like to tell you. Aphorism 200 is for follow-up in homeopathy. Absolute follow-up. We haven't read it. Aphorism 200 says the external signs of psora. The externally you have to see on the body. Now, if we have 200, का बहुत बड़ा गड़बड़ है. And that is mainstay of the follow-up in my case. Every case has to go through this. Every case, because what had happened? Where you can see the disease? The external manifestation, either maybe on skin or even the clinical signs are external manifestations. Enlarged liver, enlarged whatever, the laboratory findings, they are all external files. Yes. Now, while treating the asthma, we don't pay attention to small dryness, little itching here and there, callosity here and there. The callosity, what he has written, that the aphorism 74, he also writes callosity. The callosity on the palm soles, if they remain during your treatment, that means psora is still active. Psora is still active. Now he read, the head is still there been present, the local affection, the guide to the internal treatment, that is the oral treatment which we give. The homeopathic remedy for the whole disease might have been discovered. If they are there and that had been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet completed. So when you are treating the asthma, you must look out for this. External signs of psora. Psora is nothing but the inflammation, chronic inflammation anywhere in the body. So chronic inflammation creates a lot of injury into the body. That is what Robbins have said. What happens when the injury occurs? Induration, hypertrophy, metaplasia, hyperplasia. That is what happens in this. Diseases are like that. Yes.
The same case reappearing after say some time.
Yes.
Same logic applies.
Is same. So whenever I even guide to my patients, ये सब जाएगा तभी मानना कि तुम्हारा बीमारी है. We take that challenge after this 200. Next. But it's very cured on its seat. This in its seat यानी ये seat का मतलब क्या? समझा ही नहीं. He has not explained. Seat यानी the primary disease. Hello. But were it cured into its seat? ये seat अभी तक समझा नहीं था. See, this is what ambiguous. Whatever he has written in his own mood. जो भी लिखा होगा. This would have been convincing proof that the disease was completely eradicated. If disease was completely eradicated, the asthma, the eczema will not come. It was partially treated. Everybody is happy. So patient is happy. हमने भी बोल दिया अच्छा है ठीक है अभी बंद कर दवा. But the primary is that you have to see the external signs of psora. Every patient has to be seen through that.
But if you stop the medicine,
No, you should not stop till that signs are there.
if you stop the medicine, the eczema gray usually disappears.
No, it should not. Even if it appears, that's what I'm saying. Even if it disappears, it has to come with something else. It is like primary asthma is gone, eczema is gone. Then eczema, it is maybe as transiently your medicine has acted on that, and that is why it has gotten cleared. It cannot come after 6 months or 1 year. It can, if that comes after 1 year, it is the parallel disease or some other parallel expression of the disease. And the desired recovery from the entire disease was fully accomplished, an inestimable, indispensable advantage to reach a perfect cure. The aphorism 200 is the mainstay of taking follow-up. 200. And this is the follow-up by Hahnemann. That how the disease enters in, that is has to be very clear, and how the disease primarily develops, that is one. And if treated, not treated, what happens, that he has seen in 74. And same is developed by Robbins, that because of the diseases, how the body responds, and that he has given everywhere. The cell injury, that is same word, induration, hypertrophy, loss of sensation, paralysis, loss of everything.
Okay.
Hahnemann has said one place, to bring this diseases out onto the skin, he has applied plaster for many weeks, and he got the blisters on his back. Okay, but that doesn't mean that disease has come out. Exteriorization he has tried on himself also. And after that, he saw that by bringing out the blisters on the back, and if you remove the plaster, blisters are gone. The applying plaster and bringing the blister back was a mechanical, local. It is not, body has not played role into that. The internal immune system is not playing role into that. Old school. Physicians should now destroy the local symptom by topical application, the sulfur which you are saying. Barabar? The external remedies under the belief that they have treated or cured the disease. Nature makes its laws by rousing the internal melody, which we said very first. Internal melody कौन सा? Primary से अंदर गया था वो. And other symptoms that previously existed in the latent state. It is not that disease is driven back. That is what he is saying. It is not the disease which is given back. It is the internal, external you have removed. That means dermatologist को लगता है कि गया, patient भी मानता है कि ये सब गया. But when it comes repeatedly, they said कि जाता नहीं है, कुछ गड़बड़ है. When that happens, the nature makes its laws by arousing the internal melody and the other symptoms that previously existed in the latent state. Next, with the local affection, that is to say, this increases the internal disease. That is usual. When this occurs, it is usual to say. What you are saying, it is usual to say. But this is incorrect. Though it is incorrect. वो खुद बोल रहे कि ये इनकरेक्ट है. अपना नाम बना के लिए मैं कुछ भी थियरी रख सकता हूँ ना. आई हैव नॉट पुट अप एनीथिंग ऑफ माई. पूरा रॉबिन्स क्या बोल रहा है, हनीमैन क्या बोल रहा है, एंड दैट इज व्हाट आई हैव बीन एक्सपीरियंसिंग लास्ट 37 years. Don't believe anybody. जो practically what we see in my practice, I should be able to explain. I should be able to explain my own results. I am able to explain on theory of chronic disease and aphorism and by Organon only. ये बाहर वाले तो आज है कल नहीं है, उनका क्या भरोसा. Next. And you know what is mean by cure? Perfect cure. The word he has used. Perfect cure. The cure as per the science of homeopathy. And that he writes in 213. What should be the homeopathic cure? The cure as per the homeopathic science. And how you can get the cure as per the science. अगर इनको follow करेंगे बाकी के सब filter हो जाएंगे. बाकी के सब. Because they are spreading the knowledge which there should not be. 200 much है. Perfect cure. 200 much है. Make it large. A perfect cure. Indispensable advantage to reach a perfect cure. When you see the external signs of Sora and you follow that guideline which the patient is saying, आपके सामने you are responsible to whom when they come to treatment? Your patient. No knows these theories, so-called theories. Patient को जवाब मैं देता था suppression की theory में जाके, तुम्हारे बाल जरा फिक्र मत करो, आ जाएंगे वो तो. Patient was ऐसे नहीं, सब बाल निकल गए उसके. और हमारा दूसरा दोस्त था पंजाब का, वो पंजाबी स्टाइल में तुम टट्टी करते रहो, कुछ नहीं होगा, तुम्हारा सब ठीक हो जाएगा. डायरिया का पेशेंट, अल्सरेटिव कोलाइटिस को वी हैव सीन नोटिस. भावनगर से पेशेंट आया, बिग फार्मा कंपनी का मालिक, उसकी औरत को एलोपैथी कुछ नहीं करता, होम्योपैथी में आया. तो वो वही बोलता है डायरिया होता है, करने तो डायरिया तो होते रहता है, वाई यू वरिंग अबाउट डायरिया. पेशेंट लॉस फ्रॉम 58 किलो टू 48 किलो, चलता रहता है, डायरिया तो आता है. दे डोंट सी क्या हो रहा है. क्लिनिकली दे आर जीरो. So when the clinical they are zero, they have been mocked by allopathy. They have to be mocked. Without base of science, they are practicing. They don't have science of homeopathy as their base. They don't have allopathy as a base of their science. And they are doing all layman language. बोला है सब बाहर आना चाहिए, टॉक्सिन बाहर आते हैं. And I have not seen Hahnemann saying exteriorization a single word anywhere. Single word about exteriorization. And then you have to follow the man who has followed the science. And the people were saying the herring. Now this, when you give the internal treatment, what should happen then? The internal miasm, what you are treating, whether the external signs should go first or internal to go first.
Internal.
So are they same time or different time? The problem is here. Now what he said, go back to again. अच्छा हुआ ये point याद आ गया. ये theory में जा के दिमाग में उधर से बाहर ही नहीं निकलता. Go back how the disease comes. Yes, make it large. So how the disease originates, इसीलिए बोलता हूँ, again come back to base. This is very crucial that whether you have started. First, the infection. What is second? Incubation. That means the whole disease or the disease goes to the whole body. Fine. And third is expression. यानी जो disease बाहर है, उसका the base is inside. If you, that what he says every now and then, every page में लिखा है. अगर inside को ठीक किया तो बाहर तो ठीक होना ही है. So external is dependent on what? The callosity on your or warts or whatever is dependent on interior. अगर जो treatment देते हैं internally, तो external कब जाएगा? Simultaneous. He has written 10 aphorisms. How many? 10 aphorisms. कोई पढ़ता नहीं है. 190 200, 190 to 200. Simultaneously it has to happen. And 192 or 195 it is very clearly written, it happens at one and the same time. इंटरनल जब दिया, इंटरनल ठीक होता है तो एक्सटर्नल ठीक होना ही होना है. एंड पैरेलली होता है, क्योंकि क्या होता है, दी आफ्टर दी infusion, third is breaking out. So whatever is outside hanging on is because of internal. Support ही नहीं रहा उसका, तो external टिकेगा कहाँ से? That's what it is. Third. Next.
Yes, sir. Very good question.
So try to, I would say that everybody, the one who are present here, to make some questions or some contradictory statement if they have, must have it. Give me on a WhatsApp or come down to the next time, whatever, take the appointment and we'll discuss it in detail. This has to be very clear because there lies the follow-up of your cases. And he has given clear-cut direction how the follow-up should be. After giving remedy, what happens?
So,
So-
then how about the use of those external applications?
That's
Let's
not-
say in psoriasis, what patients do.
So if the patient has a fulminant all over body, say vulgaris, whatever, and patient is too far, very severe expression, it's okay. दो local तो क्या हुआ, बाका body तो चालू है ना, clear है. It is there all over.
But then they apply the corticosteroids and all
That's right.
that has to be avoided, or
They let them apply for two spots they are applying, but the rest of the body is showing you where they are. So here also the Robins comes into the play. When they are applying locally, the other cells which are affected, what is their condition? Inflammation किधर गया वो? क्या level पे है? जैसे ये कम होगा तो साथ में पैरेलल ये भी कम होना है. They don't apply. Once that irritation is gone, nobody wants to apply. They are doing it. They know they are doing it because कुछ दूसरा है ही नहीं. There is no alternate. So I am doing it. But if the irritation doesn't remain there, it will not apply. Yeah.
So then why the use of word suppressed eruptions in old repertories?
It is repercussed eruption. Suppressed means they do a lot of manipulation. Like as I said, there is cold bath, warm bath. सबसे suppress होता है ना. It goes inside. But inside means what? Internal miasm becomes more stronger. That is what he says. It becomes in dominant position. Your immune system takes it back seat. So the disease gets aggravated and aggravated. The new diseases comes in.
It's just inward evolution. It's just
No, it is inward पहले ही दिन से था. They get chance to get out, break out. Breakout is more severe and more severe.
sir. So continuing my question, the same corollary applies to all the rheumatic affections as
Yes, it is.
well, wherein they can continue with the biotics and continue. With
No, then you have to see that how much severity has come up. The moment it is less, patient will give up. They don't want to take. That is why they have to come to us with some alternate. थोड़ा बैलेंस करके चलना पड़ता है. थोड़ा बैलेंस. I would say that one case you remember. तो chronic conversion का patient आया था. उन्होंने बोला सब दवा बंद कर दे. थर्ड डे पेशेंट स्टेटस एपिलेप्टिक्स में एडमिट हुआ. सेम. क्यों बंद किया भाई? Why? You can't stop those medicines if they are taking. If he can't handle, if he can't do it, we know patient has to be comfortable. If he can't do it, you don't find the homeopathic remedy in such severe cases difficult to find sometimes. We ask them कि इतना थोड़ा consult करके आओ, फिर बाद में देखते हैं. But we have seen that by doing parallel, slowly, gradually, patient want to give up, and they do give up. And by end of 6 months, 12 months, they are free of both. But पहले ही दिन सब बंद करो, ये नहीं होता. That should not happen. So en masse सब दवा बंद करके आओ, बाद में देखेंगे वो जमाना गया, टाइम भी गया. You may get sued also. A status epilepticus का mother, you have to see that mother and child how they are suffering. नहीं बंद कर सकते सब दवाई. आई एम टेकिंग नेम बिकॉज दे वर टीचर टू अस, और वही लोग पढ़ाए और वही मुझे करना नहीं होता है. आई हैव टू फॉलो दिस, नॉट दैट. वो तो प्रैक्टिकल नहीं है उनके पास. वो थियरी पढ़ के वही आप लोग पढ़ेंगे, वही देन सेम मिस्टेक्स एंड सेम एवरीथिंग, सेम कॉम्प्लिकेशन टू इनवाइट नहीं हो सकता है. यू कांट गिव अप दी ऑल दी मेडिकेशंस. ये अनवांटेड रहते हैं, 10 में से 5 अनवांटेड, यू कैन स्टॉप दैट. बट वाइटल मेडिसिन यू शुड नॉट टच दैट. Gradually patient will come down with the biological and the investigations coming around to normal, and you feel that now it is everything. Then in that case also the external signs are guide to me. Whether they are going off, it is getting cleared, then it is homeopathy is acting. There has to be signs that yes, my homeopathy is acting. That is acted. Homeopath का अभी तक का सबसे बड़ा गड़बड़ है, they don't know whether the medicine is acting. सबसे बड़ा practically try to accept, नहीं मालूम. So this is the guide. And then 200 का aphorism. He writes very clearly. But his words are that ambiguous, that is very artistic word. The guide to internal treatment. कोई पढ़ता नहीं, कोई नहीं पढ़ता इसको. Go and read 190 to 200, you will get the enlightenment into the homeopathy, what happens after the medication. We don't know what happens. Then what to expect out of patient? खाली अस्थमा गया तो यही होता है, अस्थमा गया एक्जिमा आया, अस्थमा किधर गया मालूम नहीं, फिर आ गया एक्जिमा. वी फील दैट सप्रेशन, लिव इन दैट illusionary and illusion world. होम्योपैथ का प्रॉब्लम हुआ है, they live in that world. That is why the different theory keeps in without any filtering, without any double check, they get into that, and that is the problem. Now coming down to the Herring's law, what you were saying. Come, Herring's law. Will you writing, Chan? Yeah. So if they are requested, everybody is requested to read this book. Life and Times of Herring by Knerr. Knerr was, anybody idea? जमाई, दामाद था उसका, उसकी बेटी को दी फर्स्ट हेयर यानी वारिस हेरिंग का ये था. He was there for large number of years with Herring, and in his book, page number 314, I am writing with the page, very clear. Dr. Herring was co-founder of Hahnemann College and Hospital at Allentown, Philadelphia. Everybody knows, right? Where he taught for a long time the doctrine of homeopathy, according to the Organon, which as a true disciple, he himself honored in interpreting. What is the Organon? Interpretation. For long number of years. Now, if you read 190 to 200, you will feel that Herring's law जैसा कुछ था ही नहीं. Herring's law तो लिखा ही नहीं है वो लोग. Herring has not written the Herring's law. बट उसका नसीब अच्छा है, अपना एजुकेशन पूरा उसके ऊपर चल रहा है. वाह हेरिंग्स, वाह हेरिंग्स, वाहवाही मिलती है ना. विदाउट एनी कंट्रीब्यूशन, इफ आई गेट टू मच ऑफ वाहवाही, एंड दैट इज आई एम एवरी एनुअल एग्जाम्स ऑफ होम्योपैथी आई एम देयर, एवरी एग्जाम्स. And when you read 190 to 200, you will realize that Herring cannot do this job. Herring cannot do. He has lived the Organon and true disciple of the homeopath and the Organon. He has not less than 15 years he was teaching. And you must read this book. Knerr ने कहाँ लिखा, क्या लिखा. That's what I'm saying, that Herring's law, Herring कैसा लॉ ही नहीं है. Herring ने लिखा ही नहीं लो, किसने सलाह दिया, किसी ने उसका लगा दिया. This is what then that what I am saying. That is what I am saying is saying after so many, बहुत मार खाया इधर उधर, बाद में कुछ पढ़ा है. भाई ये सच नहीं है तो सच कहाँ है? Where is the truth? वो truth because I am responsible to the person sitting in front of me. Whatever the position as a doctor, it's fine, it's apart. But unless you give them results, they are not going to stay with you. And if you want that homeopathy to come up, you have to follow Herring, Hahnemann, because he has been true disciple. Right? So that's again one thing. Kant's 12 law, Kant has not been respected other than India. You go anywhere in the world, nobody knows him. Why India? Chal gaya, chalne do. We made the survey by ourselves into our group. We gave them slip that everybody is practicing. It is not just they are with me. They have their own practice. They have their own experience, personal, that how the patient behaves after giving the remedy. So 12 रिएक्शन है ना, उसमें से एक ही रिएक्शन बैठता है जो which we see, and out of that 11 are not fitting into their practical experience, into your practical life. But 12 रिएक्शन पास होने के लिए अच्छा है, हो गया, ठीक है. After that in practical life they are not there. The follow up is mass in homeopathy. How to take follow up पता ही नहीं है. So this is where the follow up is, and this is where there is no suppression. Don't feel guilty about it that you are suppressing. That even with allopathy it doesn't suppress. Let the people think and talk about it. I know very well why they don't suppress. I know I am going through this, and that day in and out what Hahnemann has said we are experiencing. Yeah, any questions, anybody?
Sir, suppress, I think in that form it will be find that lot of use of antihistaminic can cause vasoconstriction and attack. So वैसे बोल सकते
That is adverse reaction. That is adverse reaction
side effect.
for side effects.
એટલે બોલે કે suppression ની side effect ને adverse effect નું બધું એમ
Yeah, બધું that's a crisscrossing. It's fine.
but flare up of steroids that doesn't make पूरी बीमारी अंदर जाए.
हाँ, that's what. That the पूरी बीमारी जाती नहीं है.
steroid लगाए अंदर
So पूरी बीमारी अंदर जाती नहीं है. अंदर already it is like I am not going according to this. हिंदू philosophy में कहते हैं छठी के दिन क्या होता है? After the baby takes birth, you know विधाता आता है. विधाता लिख के जाता है. इसका ये होने वाला है, इसका होने वाला है. That's what it is. Cradle crab, he starts, if you read that, cradle crab से सब बीमारी चालू होती है. Hahnemann says, and the groin में जो होता है, the atopic skin, that gets suppressed, and that it gets suppressed may not be the manipulation by allopath or by homeopath. Even if it may get suppressed on its own. What chapter मैंने नहीं लिया था, वो slide इधर. Disease gets suppressed on its own also. It's not that you are manipulating or I am manipulating. It disappears on its own. Sometimes we don't know the reasons why it disappears, but it disappears. It is manipulation every time, जरूरी नहीं. It was not happening 200 years back. जब ये allopathic ointment ही नहीं आया था.
It disappears without introducing homeopathic.
Yeah, even without homeopathy, it may on its own, but it is not that we push that in. This is already एक बार आ गया. That means it is there. विधाता लिख के गया. ये हुआ है. अभी ये होने वाला है सब आगे जाके. But provided that you have that clauses he has written. One person develops one disease, another develops another disease according to their constitution, according to the situation and the area where they live in. That is how they develop the disease. Fine?
So do we have time for one more question?
Yeah. Yeah, come.
No, so how can we be sure कि cure हुआ है? So
वही.
how do we know कि everything is cured?
So external science का slides है अपने पास. पूरा ये है. What do you can say? I have prepared a big PPT we have. Where are the signs to be seen externally? Academic master. Yeah, chalo, कोई भी लाओ. So how many are there? Only 4 अच्छा भी. Long slides we have. I'll show you the patients के जो photograph लिए थे. बीच में एक आध को ऊपर नीचे जो नीचे जोइए लेना नीचे ले. Only skin का है. Yeah, this is in words, but I will show you first in photographs. So जरा सीधा easy रहेगा. Clinical conditions to see is it. These are the few I would say that. Yeah, these are few. That it's not full list. I think somewhere it may be. So you try to imagine that wherever you get the external signs to see, that is, one is the seborrhea on the scalp, one is behind the ear, you have a lot of dryness. Patient may have a lot of dryness. Or the next slide, make it larger, that will be easy. Yeah, like that. If that remains, even this much is the indication that psora is active. Hahnemann says even small boil anywhere else on the body is also a sign that psora is still active. It's a sign of psora. And then these are not scars. This patient had a lichen. Okay. So lichen, when it is active, you see that they are raised, or they may be itching mark. They not be. It is not post-inflammatory. Post-inflammatory inflammation is gone. The disease is gone. But inflammation is there. तो थोड़ा lichenified रहेगा, raised रहेगा. So that means disease is active. It is quiet, बहुत लंबा चलेगा, but है disease active. Even long-standing ये रहेगा ना, like this, callosities, the nails which are distorted, along with alopecia areata or a totalis, you may get like that. The psoriasis, severe dryness on the elbows. Next. These are the signs externally. Patient may not show you, but I see every patient का back. इधर ही सब under carpet रहता है बहुत कुछ, है ना? So even this much, the constant dryness of lips and picking up. That's because of the irritation there. It's again a itch. So that's the psora. The constant eyes में conjunctivitis or the allergic conjunctivitis, what you say. So I see every patient का like icterus or the pallor. This is third one to see the inflammation there. Then these are the distorted nails. The list में जाएंगे तो भी चलेगा. So list are scalp में क्या मिलता है? Seborrhea. Make it large तो सबको पढ़ने को आएगा.
Sorry, should be the remedy.
And,
Based on constitution, and then if that miasm is active, it's fundamental.
I'll just finish this and I'll come back. So skin में externally, is it readable?
Yes.
So constant dryness anywhere on the body, as I showed you that, severely constant dryness. Whenever we give the anti-miasmatic, within 1 week to 1 month, this goes off. पूरा ड्राइनेस निकल गया, खाली पोस्ट इन्फ्लेमेटरी मार्क रहता है, दैट्स नॉट इन्फ्लेमेशन. और इन्फ्लेमेशन का थोड़ा भी साइंस किधर आया, दैट इज अ सेल इंजरी, दैट मीन्स इट इज मायासम इज एक्टिव. देन सीवियर डिस्क्रोमिया, बच्चे लोग को होता है ना सीवियर डिस्क्रोमिया. म्यूकोजल थिकनिंग, दैट इज कॉलोसिटी, पाम, सोल्स, नकल्स, fissures, toes, persistent itching on and off throughout, it may be trivial, cracks anywhere, roughness, hardening, lichenification, callosities, topic, mucosal secretion through small stimulus, very severe secretions, like थोड़ा सा आँख में गया कि इसका हालत खराब है. Persistent eruptions, lesions like eczema and ulcers, erythema, redness, constant redness, maybe here and there, it is there, it is, you have to be careful. Chronic fistulas opening, like fistula, dental wound, Bartholin cyst, chronic infections, that is ringworm, tinea, persistent pathological discharge, seborrhea, say even sometimes fistula, seborrhea, scaly dandruff, dermatitis, hair fall, alopecia, itching, ears में, itching in auditory canal, persistent discharge, cracks behind ear, I showed you that. Eyes में muddy sclera, because of constant irritation, they develop very brownish tinge behind, below the eyelids, lower eyelid. Pallor of conjunctiva, cracks at the nasal aperture, callosity, growth, pigmentation, face का आ गया, ulcers on lip, mouth, recurrent stomatitis. Even if your patient is completely all right outside, and they develop constantly inflammation into the buccal mucosa, that's the psora is still active. Pyorrhea, halitosis, all disease. Yeah. Severely mapped tongue, I don't have right now, but we'll bring out. I have seen the mapped tongue, severe, get normalized. Epithelium gets repaired. When the psora is gone, that's the beauty of homeopathy. Just see that how fine the tongue layer comes out. Thicken and dark band on the skin neck, वो बहुत tough है ये. Tinea, groin में itching, this is one, as I said, below the carpet wala. Paronychia, dry nails, brittle nails, poor discharge, dyspareunia, less of discharge or too much of discharge. That's a big problem. Yeah. So this is one. Second external signs, which is in modern science now, it is not external, but they are finding out what is the bad in internal. That is CBC. So you can say biochemistry. That is also you can know by that whether miasm is active or not. And third is clinical finding, the organs for abdomen, RS, extremities, wherever you see. So examination by allopath may be clinical only, but for us it is too much. There are trivial appearing, but they are exact sign that psora is active inside, and that means you have not completed your cure, or the patient has not reached to the complete cure. You may have to work for more. Okay. So yeah. Thank you very much.
Thank you, sir.
Thank you.